What is GERD in children? GERD, or Gastroesophageal Reflux Disease, is a long-term, chronic digestive disorder. It happens when stomach contents flow back up, reflux, into the food pipe, esophagus, and cause symptoms or problems. GERD is a more serious and long-lasting form of gastroesophageal reflux, GER. GER is common in babies under 2 years old. Most babies spit up a few times a day during their first 3 months. GER does not cause any problems in babies. In most cases, babies outgrow this by the time they are 12 to 14 months old. It is also common for children and teens ages 2 to 19 to have GER from time to time. This doesn't always mean they have GERD. When GER becomes GERD, your baby, child, or teen may have GERDIF. Your baby's symptoms prevent him or her from feeding. These symptoms may include vomiting, gagging, coughing, and trouble breathing. Your baby has GER for more than 12 to 14 months. Your child or teen has GER more than 2 times a week for a few months. Hi, Joshua here. What's your name? Well, I can't really hear it. Just comment down below under the video given to you by the Stomach Health Channel. Let's get on with your stomach. What causes GERD in a child? GERD is often caused by something that affects the LES, the lower esophageal sphincter. The LES is a muscle at the bottom of the food pipe, esophagus. The LES opens to let food into the stomach. It closes to keep food in the stomach. When the LES relaxes too often or for too long, stomach acid flows back into the esophagus. This causes vomiting or heartburn. Everyone has reflux from time to time. If you have ever burped and had an acid taste in your mouth, you have had reflux. Sometimes the LES relaxes at the wrong times. Often your child will just have a bad taste in his or her mouth, or your child may have a short, mild feeling of heartburn. Babies are more likely to have a weak LES. This makes the LES relax when it should stay shut. As food or milk is digesting, the LES opens. It lets the stomach contents go back up to the esophagus. Sometimes the stomach contents go all the way up the esophagus. Then the baby or child vomits. In other cases, the stomach contents only go part of the way up the esophagus. This causes heartburn or breathing problems. In some cases, there are no symptoms at all. Some foods seem to affect the muscle tone of the LES. They let the LES stay open longer than normal. These foods include chocolate, peppermint, high-fat foods. What would you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. Other foods can bring on symptoms because they are acidic. These foods include citrus foods, tomatoes and tomato sauces. Other things that may lead to GERD include being obese, medicines, including some antihistamines, antidepressants, and pain medicines, being around secondhand smoke. Which children are at risk for GERD? GERD is very common during a baby's first year of life. It often goes away on its own. Your child is more at risk for GERD if he or she has Down syndrome, neuromuscular disorders such as muscular dystrophy and cerebral palsy. What are the symptoms of GERD in a child? Heartburn or acid indigestion is the most common symptom of GERD. Heartburn is described as a burning chest pain. It begins behind the breastbone and moves up to the neck and throat. It can last as long as 2 hours. It is often worse after eating. Lying down or bending over after a meal can also lead to heartburn. Children younger than age 12 will often have different GERD symptoms. They will have a dry cough, asthma symptoms, or trouble swallowing. They won't have classic heartburn. Each child may have different symptoms. Common symptoms of GERD include burping or belching, not eating, having stomach pain, being fussy around meal times, vomiting often, having hiccups, gagging, choking, coughing often, having coughing fits at night. Other symptoms may include wheezing, getting colds often, getting ear infections often, having a rattling in the chest, having a sore throat in the morning, having a sour taste in the mouth, having bad breath, loss or decay of tooth enamel. GERD symptoms may seem like other health problems. Make sure your child sees his or her healthcare provider for a diagnosis. How is GERD diagnosed in a child? Your child's healthcare provider will do a physical exam and take a health history. Other tests may include chest X-ray. An X-ray can check for signs that stomach contents have moved into the lungs. This is called aspiration. Upper GI series or barium swallow. This test looks at the organs of the top part of your child's digestive system. It checks the food pipe, esophagus, the stomach, and the first part of the small intestine, duodenum. Your child will swallow a metallic fluid called barium. Barium coats the organs so that they can be seen on an X-ray. Then X-rays are taken to check for signs of sores or ulcers or abnormal blockages. Endoscopy. This test checks the inside of part of the digestive tract. It uses a small, flexible tube called an endoscope. It has a light and a camera lens at the end. Tissue samples from inside the digestive tract may also be taken for testing. Esophageal manometry. This test checks the strength of the esophagus muscles. It can see if your child has any problems with reflux or swallowing. A small tube is put into your child's nostril, then down the throat and into the esophagus. Then it measures the pressure that the esophageal muscles make it rest. pH monitoring. This test checks the pH or acid level in the esophagus. A thin plastic tube is placed into your child's nostril, down the throat, and into the esophagus. The tube has a sensor that measures pH level. The other end of the tube outside your child's body is attached to a small monitor. This records your child's pH levels for 24 to 48 hours. During this time, your child can go home and do his or her normal activities. You will need to keep a diary of any symptoms your child feels that may be linked to reflux. These include gagging or coughing. You should also keep a record of the time, type of food, and amount of food your child eats. Your child's pH readings are checked. They are compared to your child's activity for that time period. Gastric emptying study. This test is done to see if your child's stomach sends its contents into the small intestine properly. Delayed gastric emptying can cause reflux into the esophagus. It's extremely painful on your chest when you have acid reflux. You just want to make it go away. What if I told you you could make it disappear into oblivion without making your throat hurt? Eating the medicine like a candy. Well, this is what Pepcid does. Chewable mint-flavored candy-like medicine that would make your acid reflux pain disappear for a whole day. Don't just take my word for it. Look at these 3,000 5-star rating. It's also important to remind you that I'm in no way sponsored by Pepcid. It's just a great brand that I found on Amazon to be an affiliate. This means that if you'd like to buy Pepcid, clicking on my link in the description would help me massively because I would be receiving a commission for each purchase. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.